if I reflect when I was growing up and I was at school, if you'd have told me, I never thought I was going to be a politician even, but if you'd have told me that I'd be happy and comfortable within myself to lead on LGBTQ plus work for the Welsh Government, I wouldn't have believed you. So it is a real privilege to be in this position, but it's something that's really important personally to me as well, to be part of leading the work to shape communities in a country, a Wales that I would have wanted to grow up on, and where we can build on the work that's come before us to actually enable me to be here and be myself today.
Over the past few years, there's been a radical shift in the way that people talk about sex and gender in America. All of a sudden, it seems like nobody can agree on basic questions like, what is a woman? What's the difference between sex and gender? And are these categories even real or meaningful? Transgender activists are pushing for greater levels of acceptance and inclusion, while likening those who disagree to transphobic bigots. At the same time, many feminists worry about what they see as the erasure of women's role in society, the unfair competition against trans women in sports, and their daughters feeling unsafe in school bathrooms. It's one thing for adults to live and present themselves as they choose, but when children, legally unable to consent, start being chemically and surgically altered, sometimes permanently, the issue becomes more complicated, and it's not surprising that many parents are concerned. Last year, the World Professional Association for Transgender Health removed all age restrictions for hormone therapy and surgery. Puberty blockers are sometimes prescribed to delay the development of secondary sex characteristics until more drastic measures can be taken. Across the states, a legal battle has been waged over this issue, with states like Florida attempting to ban those procedures for minors, while California wants to prevent parents from stopping or even knowing about the treatment their children are undergoing. Are we helping children to affirm who they really are inside? Or are we indoctrinating them into a cult of gender ideology that could leave them scarred, literally and figuratively, for life? Where did gender ideology come from? And how has it seemingly taken over our schools, captured our medical institutions, and co-opted government policy? I spoke to Lior Sapir, a fellow at the Manhattan Institute, who wrote his PhD on how government regulations have affected the introduction and prevalence of gender ideology into schools.
Critical theory has been, I would say, the dominant intellectual paradigm in schools of education for several decades now, especially on the racial issue. But once they adopted it on the racial issue, the doors were open for the gender issue as well. So, the schools of education are the gatekeepers for belonging to the teaching profession, certainly in the public schools. And so, any teacher who wants to become accredited and teach long-term in public schools has to go through these kind of centers of critical theory indoctrination. And I'm saying that sincerely. They are centers for critical theory indoctrination. That indoctrination is not always successful, but in many cases it is.
As an outgrowth of critical theory, gender ideology attempts to view the world through the lens of sex and gender. And as a facet of postmodernism, it seeks to replace any concept of objective truth with the subjective feelings of the individual.
Gender ideology really encompasses two distinct and incompatible philosophical positions, or I should say orientations. One is queer theory, but the other is what I would call gender identity essentialism. And queer theory states that not just gender, but sex itself is a social construct, right? So the feminist distinction between sex and gender, which was meant to call attention to the socially constructed aspects of human sex differences and to show that, assumptions about what's, so to speak, natural to women and natural to men is really just social attitudes. Queer theory takes issue with feminism of that sort. Queer theory says, no, it's all gender. There's no such thing as sex. Even the body itself is socially constructed, which is a very kind of bizarre proposition. I won't get into that right now, but it's enough to just point out that queer theory dissolves the idea of biological sex, of objective reality, into social constructivism. When you hear the claim, for example, that sex is a spectrum, or you hear claims about sex being, quote, assigned at birth, these types of claims come directly out of queer theory.
Biological sex is fake. Yes, we all know that gender roles are fake, but do not say to a trans person, biologically male, born female, male-bodied. No. There is no biological criteria for gender that is both universal and a binary in human beings. Where does that leave us? Free.
Queer theory posits that gender is not who you are, but a performance, meaning that in order to be a woman, all you have to do is act like a woman. And yet queer theory also maintains that strict gender roles are based on an oppressive system of social regulation. One of the goals of queer theory is to perform a non-binary identity, which is to intentionally blur or obfuscate gender categories. This is the true goal of gender theory nonconformity.
So to put this another way, the kind of transgender, let's call it transgenderism, that we see nowadays in mainstream discourses, right? The kind of the Caitlyn Jenner, the Laverne Cox, the Jazz Jennings, all these people who want to appear to be exactly like the most typical members of the opposite sex. According to queer theory, these are not nonconformists. On the contrary, they are absolutely conforming. And in fact, you could, I think, make the argument that they're conforming even more so than people like you or me, for whom, gender is kind of a more spontaneous and unthinking performance. Because if you do the performance deliberately and you take on all the most stereotypical trappings of the opposite sex, then you're performing gender consciously. In a way that's normative and scripted. The other position that marches under this umbrella term gender ideology is what I've been calling gender identity essentialism. And this is almost the polar opposite, right? It agrees with queer theory in the sense that it disregards the body as having any relevance for our status as sexed or gendered beings. But even that turns out to be not exactly true, because the claim made in this particular philosophical orientation is that gender identity is rooted somehow in the deep self, the natural self, not the socially constructed self, right? The self that exists prior to socialization, prior to cultural imposition. And I think if you really go to kind of policymakers, the medical establishment, mainstream cultural institutions, you're a lot more likely to see the claim that gender identity is brain sex. I mean, they say this explicitly. It's rooted in the brain, right? In other words, one is born with the brain of the other sex. And from this, set of assumptions, it's not hard to see why this would authorize medical transition of minors. Because if you're born with a female brain and a male body, or vice versa, and there's nothing you can do to change that, and it would be agonizing for you to have to live, to be forced to live according to the sex that's not your brain, and there is a technology that's relatively safe for you to make your body conform to the brain, why not do it? In fact, it would be cruel not to do it.
Dr. Sophie Quinney is head of Wales's only gender service clinic in Cardiff.
I'll start with the basics. Sex is assigned at birth by observing the external genitalia. Like many biological systems, there can be variation in sex chromosomes and their expression, and how sex hormones interact with the body's receptors. Sometimes, but not always, differences in sex development, also known as intersex, are observed at birth. Gender identity is an internal sense of oneself as being a boy, man, girl, woman, or something else. While gender roles can be informed by the social world, evidence suggests that gender identity is rooted in neurobiology, in a part of the developing forebrain also influenced by sex hormones, but at a different point in time to the development of the genitalia. Being separated in time offers the potential for sex and gender identity to be influenced independently.
Queer theory and gender identity essentialism make two opposing claims: that sex is a social construct, and that trans people are innately born members of the opposite sex. These can't both be true, but they are both used simultaneously by trans activists to argue that transitioning is good and healthy for young people, and that gender ideology should be taught in schools.
There's a lot of other subtle mechanisms by which these ideas have entered into public schools. So let me give you one example, and this was kind of what I focused on in my own doctoral work, and that is the use of Title IX, the 1972 federal law that says you cannot discriminate on the basis of sex. The Obama administration, through a complicated, convoluted series of administrative guidelines, investigations, and court agency interactions, expanded Title IX to say, as a condition of receiving federal funds, schools have to treat students who reject their sex in favor of some other gender. The schools have to treat these students according to their gender in those areas of school life where sex separation is still legitimate. So restrooms, locker rooms, sports teams, sex ed, classes, things like that. Now, it's not as though the Obama administration got together and kind of deliberately and consciously launched this policy. Rather, what happened is that through a very complicated series of investigations by the Federal Office for Civil Rights under the Department of Education, schools were gently but consistently prodded to move into this direction. When a school implements these seemingly neutral and good-intended policies, whose purpose is to promote inclusion, understanding, respect, for example, by teaching about transgender issues, by teaching about gender identity, putting up posters of being an ally to trans people and this, that, and the other.
So Nash, just like me, is non-binary. So they aren't sure if they're a boy or a girl.
They think that they're just merely providing emotional support or an inclusive environment. What they don't understand is that they are, number one, causing identity dislocation and disassociation, meaning they're taking kids for whom being a boy or a girl would otherwise just be at the background of their consciousness. They wouldn't even be thinking about it. But now all of a sudden it becomes a question. Do I accept my assigned sex at birth? Does it feel right to me? It becomes a problem, and a problem that you can solve through an act of will. You can declare yourself, assert yourself to be something else.
In the past decade, the number of trans-identifying kids has risen 30 to 40-fold by some estimates. The UK's Tavistock Clinic recorded a rise of 3,360% in number of patients between 2009 and 2018. A recent Reuters investigation found that gender dysphoria diagnoses rose 20% annually between 2017 and 2020, and then 80% between 2020 and 2021. This extremely rapid increase in trans-identifying youth has led many to wonder whether the phenomenon is real, or whether it's a sort of social contagion driven by pressure both from peers, social media, and authority figures.
We know, based on data reported by gender clinics around the world, that an extremely high percentage of kids who are referred to pediatric gender clinics are on the autism spectrum. I think the most plausible explanation is that, if you tell a kid, look, you're all these problems that you're having fitting in, adjusting, making sense of complicated social interactions are because of a condition that you have that you're going to have for the rest of your life and you have to deal with. That's a hard pill to swallow. But if you come in and say, look, all these problems of social maladjustment and feeling that you don't fit in are because you were assigned the wrong sex at birth. And you know what? We have a solution for you. If you transition, all of these feelings of distress, anxiety, and lack of social adjustment will go away. That's extremely appealing to an autistic kid, and you can understand why. They do what's known as facilitating social transition. And that refers to when a child wants to use a new name, new pronouns, use the bathrooms and sports teams that are designated for the other sex. In effect, to transition socially, not yet medically. And again, here, teachers and I think many parents think that this is just an innocent act of showing respect and being inclusive. What they don't understand is that 12 studies done to this day, the combination of those 12 studies show that if you socially transition kids before puberty, they are far, far more likely to persist in their dysphoria, to develop these dysphoric feelings and to persist in that dysphoria into puberty and then go on medication. Whereas if you just leave them alone, you just treat their cross-gender feelings and behaviors as innocent and temporary, innocent and temporary phase of identity consolidation. The vast majority of those kids, studies have shown, will desist, meaning they'll come to terms with their bodies, with their biological sex. And in fact, most of them will later come out as gay or lesbian.
You might ask, how can doctors recommend such drastic procedures with very little long-term data? The answer is that doctors, psychiatrists, and therapists make treatment protocols based on treatment standards put forth by their governing medical organizations. And unfortunately, these medical organizations have been rapidly and systematically captured by the same gender ideology activists sourcing their ideas from queer theory and gender identity essentialism.
The AAP, the American Academy of Pediatrics, in 2016, a group of 6 pediatricians got together. They basically formed the backbone of a new working group called LGBT Health and Wellness. 4 of them were kind of strong, pro-gender transition activists. They had already been engaged in transitioning kids and things like that. And 2 years later, one of these doctors, Jason Rafferty, writes a position paper on behalf of the AAP that's published in the AAP's major publication, Pediatrics, which, the fundamental argument of this 2018 paper is that the approach known as watchful waiting, which is when clinicians treat prepubertal children with cross-gender feelings and behaviors and basically say, let's just wait it out. We're not going to transition them. We're not going to affirm them as really being the opposite sex because the vast majority of them will come to terms with reality. Rafferty says, no, this practice has no evidence. It's been thoroughly discredited. And in fact, he calls it conversion therapy, right? Which is that term that's reserved for efforts to get gay people to make gay people straight. And what's interesting is that in a subsequent fact check of the Rafferty 2018 paper, it found that not only did he omit any mention of all the studies that show that the vast majority of these kids will desist by puberty, but that the studies that he cited in support of his claim that failure to affirm these kids is conversion therapy actually said the exact opposite. These studies explicitly said watchful waiting is the only scientifically supported treatment protocol for these kids. So it was a paper that was just completely distorted all available evidence. You'd be surprised to learn that this is still the position paper that informs the basis of the AAP's entire position on pediatric gender medicine. They have never, not only have they not renounced the paper, they have not even been willing to subject it to criticism. Sweden, Finland, and the UK have done these systematic reviews, and all 3 of them have come to the same conclusion, that there's no evidence that the benefits of a gender transition, medical gender transition, outweigh the risks. Florida recently commissioned an overview of systematic reviews of evidence and came to the exact same conclusion. So we have the American medical establishment is basing its recommendations on a highly dubious, cherry-picked study by a doctor whose paper never went through peer review, and that has stifled dissent and debate ever since. And tens of thousands of kids are being subjected to these treatments on that basis.
In Wales, health is a devolved responsibility. So although Mark Drakeford confirms that the Welsh Health Service will be looking at the CAS report, they do have a broader set of evidence.
Thank you, First Minister. The CAS Review's interim report to NHS England, as you highlighted just then, has highlighted several concerning issues. The interim report highlighted clearly warrants some real debate and discussion of the same services here in Wales. It highlighted really worrying issues, and I would have thought it would have prompted this Welsh Government to hold a similar inquiry in Wales on the back of those findings. Undoubtedly, there are very similar problems mirrored here in Wales. I know that the lack of reaction to this review by this Welsh Government is something that concerns politicians of all colours across Wales, MSs and MPs. Can you not see the importance, First Minister, of getting this right? The last thing I'm sure any of us want is to put children's lives at risk. So, First Minister, will you commit to a Wales-specific review of services for gender-questioning children and adolescents?
So is the Welsh Health Specialist Services Committee, which is responsible for the service in Wales, met with Dr Cass in March. As a result, we have a commitment that the review team will work with the Welsh service and providers here so that we can further define the clinical service model for the future that would be needed in Wales and any identified workforce implications. WISC intend to ask for expressions of interests from those in the field for a gender identity development service for Wales, and that will be informed by the Cass review, by the conversations that we will have with Dr. Cass, but also by a broader set of evidence that we have here in Wales.
The broader set of evidence referenced by Mark Drakeford may very well include Dr. Jason Rafferty's paper, endorsed by the American Academy of Pediatrics and thoroughly debunked by Dr. James Cantor. At any rate, it is plain what Stonewall think of the watchful waiting approach. It is conversion therapy, and something that Deputy First Minister for Social Partnership Hannah Blythyn pledges to ban.
So-called conversion therapy, which attempts to change or alter a person's sexual orientation or gender identity, is an abhorrent, draconian and wholly unacceptable practice founded in deep-rooted homophobia and transphobia that should have no place in our communities and country. It's carried out under the false pretext of therapy and inflicts severe pain and suffering on LGBTQ+ people and often causes long-lasting physical and psychological harm. When what somebody needs the most is support, to be empowered and to be loved for who they are worn down to believe who they are is fundamentally wrong and something to be cured. Welsh Government is completely opposed to this practice and is doing all we can to make it and the harm it causes history.
During the COVID-19 pandemic, when remote schooling became the norm, many parents were horrified to discover for the first time what their children were actually being taught. Now that in-person classes have resumed across the country, it's natural for parents to be concerned about what their kids are being exposed to without their knowledge.
The Biden administration is quietly trying to reinterpret Title IX to pressure schools to not inform and involve parents in decisions to socially transition their kids. So first of all, if the parents are seeing it happen, they're already, I don't want to say ahead of the curve, but they're already in a relatively good position. What can they do? First of all, gather data and evidence. That's really important. Everything you should have as much evidence as possible, because you better believe that you're going to end up taking legal action at some point. If this goes south, you're going to take legal action. Number two, get in touch with a lawyer immediately, because there's good law, federal law, that requires schools to disclose this kind of information to parents, and that sets up parents as the decision makers for healthcare and mental health care related decisions of their kids. Teachers and administrators and activists, LGBT activist groups, cannot usurp that authority, that prerogative from parents.
With attitudes around gender changing so rapidly, one can't help but wonder what the future holds. Is gender ideology the new normal, and are dissenters, as critics claim, just stuck in the past, refusing to adapt? Or will we look back on this period as an aberration, a momentary hiccup in the age-old acceptance that sex is, in fact, real?
I think what we'll see is a gradual walking away from saying, no, we never really meant it this way. We never really meant it that way. You misunderstood us. That's going to be, that's how this is going to die out. And it will die out eventually. It's just a matter of time.